Republican Senator Jim Bunning, who is here now. Well, for me, Senator, the trillion-dollar question is, will there be another health care bureaucracy? Because that's what's going to cost the lion's share in terms of cash.
Well, we think there will. As soon as Leader Reid exposes what they have come up with, behind closed doors, nobody has been there to see it, except Senator Reid and his staff, and probably Senator Baucus assisting him. But I want everybody to realize that Republicans want health care reform also. But we don't think you should take 1/6 of the U.S. economy and do it in all one big bill. We think you should break it down. We think we should pass a malpractice bill, the tort reform, to cut down the cost of insuring medical malpractice. We think you should allow small companies to band together to buy insurance to get a better cost for their employees. We think we should allow individuals to buy insurance over state lines.
Okay.
But that isn't what the Democrats have been talking about, and I don't think that's going to be in Senator Reid's bill.
Well, Senator Bunning,
they want to do it all at once.
We do know that some of the blue dog senators, such as Kent Conrad, have been very, very much for the co-op that you just, I believe that's what you were referencing, where companies would all play into a certain cooperative of healthcare. But is there a deal breaker for you? Is there one thing that you absolutely wouldn't want to see? Would that be the public option?
There are a lot of deal breakers, including the public option. There is the ability of the federal government to pay for abortions, which is a deal breaker as far as I am concerned. There's a deal breaker on costing $600 billion away from Medicare. You know, about 5 years ago, the Republicans, and I was on the Budget Committee when we did it, cut the increase in the Medicare by 0.2 and 0.4%, and they called that a cut. What do you think a $600 billion reduction in Medicare is?
Now, there are three people, Senator, there are three Democrats that folks are looking, they don't expect to get any Republicans, but Blanche Lincoln, Mary Landrieu, and Ben Nelson have all had qualms in their own minds about creating another government health care bureaucracy. What kind of deals are Harry Reid and others who believe in it trying to make with those senators right now to get them on their side?
Well, whatever that is, I'm not privileged to it, but they have been working on more than just those three, because there's more than Evan Bayh has made it pretty clear, and so is Joe Lieberman, that this shell game that they're working by putting a bill up that has nothing to do with Medicare and then asking cloture on that bill that means nothing when it means everything. That is something that we ought to really look at, and I hope the American people are aware of the shell game, just like the TARP bill was the last time when we passed that $700 billion and it didn't go to where we said it should go.
Senator, quickly, when you say shell game, could you clarify what you really mean by that? Because that's a heck of an accusation. So if you could just verbalize what you meant by that.
They're putting up a bill, a bill that has nothing to do with health care. And then they're going to take cloture on that bill. Try to get 60 votes for it.
Is that a fair assessment?
Nothing to do with it. Nothing. It will be a tax bill. And it means that if you really vote for that, then Harry would be able to substitute his bill and put it right into that shell, which means that then we'd be on the Reid healthcare bill without actually cloturing the Reid healthcare bill.
But a shell game is only good if people don't realize that it's a shell game. You have just exposed other people have.
Well, but But I want to tell you, the American people have got to be aware of what is going on, because it's hard for us who are here every day dealing with this to know exactly what is going to happen.
Senator,
and my feeling is, yes,
we're up. We've got a bunch of people to talk about this. We're up against a hard break,
and we got to talk to some congressmen. But we thank you very much for coming. As always, it's a pleasure. Please come back.
I'm just glad.
Thank you very much for being here.